All right, so this is for chapter 20, part 2 for college and high school anatomy and physiology. We're going to be talking about blood pressure, the difference in blood pressure in different valves or blood vessels, and how exercise impacts blood pressure. So literally, blood pressure is the force of the pressure pushed against the blood vessel walls. And it can differ from a vessel to another, like from arteries to veins. And its job is to push blood through that pathway that it needs to get to. So it's highest in the arteries and lowest in the veins. The blood flow in the arteries pulses or kind of revs with the cardiac cycle. We can detect that when we take somebody's pulse. So a pulse is a way to estimate how many beats your heart beats per minute. When somebody takes your blood pressure, they get two numbers. The top number is referred to as the systolic pressure. So like a typical blood pressure would be 120/80. That's average for most for humans. That top number, 120, is the systolic pressure. And what produces that top number is when the ventricles are in systole, when they're contracting. And it's the highest pressures of blood that can be pushed against the walls of the arteries. So they're maximally stretched there. Okay. And it's also measured in millimeters of mercury. The diastolic pressure is the bottom number, and it's the minimum pressure that is within the arteries. So it's produced as a result of diastole when the ventricles are relaxed. There's still blood in your blood vessels when the ventricles are relaxed. It's just at a lower amount of pressure. So that's the diastolic, so the bottom number. Pulse pressure is the pressure in the arteries added by heart contraction. So it equals the difference between the two blood pressures. Pulse pressure is 40 if the blood pressure is 120/80. And what the pulse pressure indicates, or what it's telling you, why that would be important information, it tells you how well the arteries are at recoiling or bouncing back once they're stretched. Sometimes when arteries get older or overused or overstretched, kind of like a ponytail holder, the recoil isn't as good. And that could indicate, potential problems with the heart long term. Or, it could indicate the chances of getting certain conditions with the blood vessels. So that's pulse pressure. That's why that number is interesting. Pulse, typically taken in the carotid or the radial artery by pushing two fingers against that, against that blood vessel, and you're going to feel a throbbing of that arterial wall, that blood moving through it. And that's used to estimate the heartbeat. The pulse can be more powerful, have a more forceful push to the blood. That's indicative of a higher blood pressure, and a lower blood pressure would be a weaker pulse. So in the common, like I said, are the radial and the common carotid, also in the femoral artery, and there's others. These are, and this is a figure that represents common pulse points. So if you're trying to determine if somebody's alive or to estimate how fast their heart is beating, you could take somebody's pulse. And those are the radial and the carotid are the typical, but there's other pulse points that you can get on somebody. Blood pressure is another thing that is important diagnostic tool, or to diagnose somebody with something, high blood pressure, or which is called hypertension, or just other problems. So it's good. All health professionals need to know why it's done and what kind of information it gives you. So you do it by putting a blood pressure cuff over the arm, the brachial region. And this cuff actually, when you pump it up, it cuts off circulation to the artery in the arm. And you feel pressure and it kind of hurts. And the stethoscope, if you're doing it manually, the stethoscope goes on the arm. When you cut off the blood flow and the stethoscope goes there, nothing can be heard. Nothing is audible in your ears. Okay? What will happen is then the nurse usually does the blood pressure. She'll start removing pressure. And she'll wait and she'll listen for the first sound. Or in the needle, check next time if somebody's checking your blood pressure manually, the needle will jump a little bit when it gets to the systolic pressure, or when the blood starts flowing through the blood vessels again. That's the maximum pressure pushed up against the walls. That's the systolic. That's when they write down that top number. And then they keep listening until the blood has settled down and they hear essentially an absence of sound where the blood is fully rushing through the veins or arteries. You can't hear it. And that's indicative of the diastolic pressure, or the minimum pressure in that blood vessel. So that would be the systolic, and that is the diastolic blood pressure. This graph shows how the difference between the blood pressure in the large arteries, smaller arteries, capillaries, and then veins. In the vena cava, there's pretty much no blood pressure. We also see a line here called the mean arterial pressure. We'll get to that number. So here's the systolic and there's the diastolic. Average for systolic is 120. Average for diastolic is 80. Oh. Okay. So we talked about pulse, talked about blood pressure, pulse pressure. Now we're going to talk about a term called mean arterial pressure. What this means is how good of a job your body is doing at getting blood to the tissues in your body that need it. That is mean arterial pressure. So it's the average pressure across your entire cardiac cycle, and it provides an index of perfusion. Perfusion is the ability to get blood to your tissues. I'm not worried about you remembering the math here. I'm more interested in you remembering what kind of diagnostic tool that number will give you. It tells you how well the blood is getting to the tissues in your body. If it's less than 60, that mean arterial pressure, that could indicate that your body is not receiving adequate blood. The capillaries don't really have fluctuations between the two different pressures. There does need to be a little bit of blood pressure in the capillaries to be able to move substances out of them, exchange to happen. But you don't want it to be too high to damage the capillaries because they're very important. So the arterial end has a higher blood pressure than the venous end, which we talked about already. That's the reason for filtration on the arterial end and reabsorption on the venous end. So fluid is moving in and out of the blood vessels with important things like oxygen, carbon dioxide waste. If your blood vessels don't do a good job of redistributing that fluid, and if your lymphatic system is failing to pick up fluid, maybe there's cancer, for example, there can be an accumulation of fluid. An accumulation of fluid in the body is referred to as edema, swelling. This is specifically talking about cerebral edema, so accumulation of fluid in the brain, or excess interstitial fluid. It hasn't been reabsorbed by the blood vessels. It can occur if the mean arterial pressure, so the perfusion, is over what you should have. So if it's greater than 160. So those numbers could be calculated, and physicians might think, okay, maybe this person's having cerebral edema, and that can put pressure on the brain, the functioning of the brain. Usually if that's happening, they're going to drill a hole in the skull to relieve the pressure so the brain isn't permanently damaged. This is can happen in stroke victims, like what happened to my husband's cousin. That's why they had to remove part of her skull, because it's starting to accumulate fluid. Blood pressure in the veins is pretty much non-existent. So how does the blood get back to the heart? Well, it depends on a pressure gradient. Also, two other things that we haven't talked about yet: skeletal muscle pump and respiratory pump. And then the valves help ensure the one flow, the one direction. The skeletal muscle pump, we've talked about skeletal muscles, how they contract and they squeeze. Veins are actually purposely situated between muscles, like this vein, okay? And when your muscles contract, they're contracted here, it's going to actually squeeze on the vein, causing blood to move. That's the skeletal muscle pump. Blood is pushed out, and the veins help, or the valves help keep it going in the right direction. So when you're exercising, your muscles are engaged, they're contracting. It's going to help move more blood back towards your heart. That's the skeletal muscle pump. Another reason that helps the veins get blood back towards the heart, besides valves, besides your skeletal muscles, is something called a respiratory pump. We'll talk about the respiratory system later, but in your thoracic cage, at the bottom you have your diaphragm, that large muscle, and it separates it from the abdominal wall. When you breathe air in, it's called inspiration, and the diaphragm will actually contract downward, making more space in the thorax and actually decreasing pressure. Then when you exhale, it relaxes and the pressure goes up in the thorax. Those pressure differences, if you ever held a plunger, if you moving a plunger in and out changes the volume, the relationship between volume and pressure. So, and pulling the plunger back, that's increasing the volume or the amount of space in the syringe. It actually decreases the pressure. So we'll talk more about in the respiratory system, but essentially what happens, this figure does a good job here. Here's your heart. Here are the blood vessels coming off your heart. Here's the diaphragm, and so this is the thorax, this is the abdomen. When you inhale, the diaphragm flattens, and pressure will cause blood to move into your blood vessels. And when you exhale, it then moves towards the heart. So it kind of draws the blood towards the heart because of breathing. A deep vein thrombosis, or thrombosis, like we said before, is a blood clot. It's more common in the lower leg. What can make somebody more at risk for a deep vein thrombosis is heart disease, immobility, so just laying around, or other risk factors. There's many. It feels, in that area, you could feel tired if you have a blood clot, tender in the area, tender to the touch, red. I know after I've had a baby, or 3 times I've had a baby, nurses come in and they'll touch on your legs and ask you if it hurts. Okay, they're actually feeling. Don't get scared. Don't be scared of having babies, but they're checking for blood clots, because childbirth or giving birth can cause clots to move. So, and we've already talked about a pulmonary embolus, where that clot gets moving and it gets stuck in the lungs, or the clot gets moving and stuck in the brain, is a stroke. Okay, so I think we're going to stop here for the notes. We'll talk about the rest in class, but I just wanted to give you a brief introduction to important concepts like pulse and blood pressure. So we'll stop there, and we'll talk about the rest in class if time.